Welcome to our lightning talk for the 8th International Conference on Health, Wellness, and Society. Our topic today is teaching mental health and obesity prevention classes to children in community settings. I'm Erin Rockstroh, and this is my co-presenter, Nabors. The focus of our talk today is mental health prevention programming and obesity prevention programming for elementary school-age children. Our goal is to provide some tools for those who want to use evidence-based programs with children in school-based or community settings. Thank you so much for tuning in. Here are two resources we like to use for information on social and emotional learning. The first one is the Center for Caring and Citizenship, and the second one is the Collaborative for Academic, Social, and Emotional Learning. The links are shown on the slide. I'd like to set the stage for the importance of social and emotional learning. Durlock et al. Found that participating in programs to raise social and emotional functioning resulted in improved academic performance. Here is the reference for Durlock et al. A specific program we like to use for problem solving is the I Can Problem Solve books by Myrna Scher. There is a preschool and elementary version, and the link for this is shown on the slide. It is evidence-based and targeted at interpersonal problem solving. Durlock et al. Recommended the use of interventions that target skill development. Another area for targeted skill development is violence prevention programs. Two programs on bullying and violence prevention are the Ulwius Bullying Prevention Program and the Too Good for Violence program. Both of the links are also shown on the slide. A shortcoming of programs for children is that parents are not often involved. The Families and Schools Together, also known as FAST program, involves families. This is pre-K through teen years. It prevents school failure, empowers parents, and fosters relationships with the school. The link is shown on the slide, and here is also a paper on FAST shown on the slide.
Hello, I'm Laura, and I'd like to talk about activities we do to promote children's self-esteem. One is Nice Things About You books. It's like a yearbook of compliments. You take some blank pages and maybe put some pictures on them, and children write nice things about each other to share with each other. We also do Shields of Strength. You draw a shield on a piece of paper, and older children can write down what they're good at and what they like to do, and younger children can draw what they're good at, such as jumping rope or making friends, on the shield. You can take the shield home for a pick-me-up whenever you're having a hard day. We also do some programming in obesity prevention. That's very important in the United States because many of our children are obese, 17% or more, and this leads to health risks in adolescence and adulthood, among those type 2 diabetes and hypertension. Our obesity prevention program is the Children's Healthy Eating and Exercise Program. It was developed based on materials from My Plate, Chef Sulu's, the Traffic Light or Stoplight Diet by Leonard Epstein, and the Catch program, which I'll show you in a moment. We combine these programs with good ideas on nutrition and healthy eating for kids. We also work in a lot of exercise activities. Here are two websites for two of our sources, the My Plate and Chef Sulu's websites. I also mentioned the Catch program, the Coordinated Approach to Child Health program. You can purchase this program, and it has lessons for teachers to deliver to children on different ideas for physical activity and nutrition. Physical ed teachers can deliver the lessons, and there's great information on healthy lifestyle. We'd like to talk a little bit about evaluation tools. We can use surveys to evaluate change in opinions, but we also use some qualitative tools that might be of use to you. We use commercials, where children make commercials to teach other children what they've learned in our program. And this teaches us a lot about change and knowledge. We also use interviews and focus groups, such as superstar interviews and fun groups, where kids tell us what they learned and how they're changing their behavior. Like the FAST program, we try to reach out to parents through interviews, emails, and telephone. We wanted to mention that we use pretty brief surveys, short surveys, 5 to 8 questions with parents, so that we're successful in gaining program evaluation data from them. Thank you, and here's our contact information, and we really appreciate your tuning in.